I'm Dr. Talal Al-Qaoud. I'm a transplant surgeon and a urologist here at MedStar Georgetown University Hospital. In my practice, I see patients that suffer from organ failure, kidney disease, liver disease, and I have a special interest in managing patients that have complex urologic problems that require advanced surgical techniques. I try to approach the patients as if they were family members or close or loved ones. And I try to put myself in that position and think, how would I want to be treated and what would I want my physician or healthcare provider to help me go through. The field of transplantation is probably the only field in medicine that I can think of, at least, that requires one person to give life to another person, and that's very unique and that's very gratifying. Patients should choose us here because we work as a team. We are a puzzle. Every piece of the puzzle counts, and every piece of the puzzle is equally important. We have great staff on the wards, we have great staff in the operating theater. I have great colleagues that I work with on the surgeon and physician side. And I think the way I'd like to describe our approach is we are like an Italian kitchen. Everybody has a role in the kitchen. Somebody does the pasta, somebody does the sauce, and so in the end it's al dente. I treat patients that require transplant for end-stage renal disease, patients that are specifically requiring a kidney transplant because of diabetes. We would perform a simultaneous kidney and pancreas transplant. I manage patients that also have liver failure and require liver transplant. A very gratifying part of my practice or conditions that I like to tackle or manage are patients that have complex urologic problems requiring advanced reconstruction, including vascular reconstruction or genitourinary tract reconstruction. That's an area that I have a lot of interest and experience in managing, especially when these patients have gone through a lot of the conventional approaches or the less invasive approaches. An exciting part of my practice as well is the use of the robot system for surgeries for patients. So robotic transplantation is a very exciting option we provide for the patients here. In the fall of 2025, I was very fortunate to be able to start the robotic kidney transplant program here at MedStar Georgetown University Hospital, where I performed the first robotic kidney transplant. And since then, I've been able to provide that for many patients, and it's been great. The patients do really well, and it's really very exciting because that's where the future is heading, and we're going to hopefully take that on to provide robotic transplantation for pancreas transplant and for liver transplant as well. As part of my practice, because of my background in multi-organ transplant and urology, I'm able to utilize my transplant skill set with my knowledge in urology, oncology, to tackle cases that require vascular reconstruction, such as renal cell carcinoma with vena cava thrombus, or patients that require a removal of their tumor with major reconstruction on the vasculature or the genitourinary tract. And that's a very gratifying part of my practice because it enables me to help these patients, and it also gives me an opportunity to work with my colleagues from urology oncology. You know, robotic transplantation is great, but unfortunately it's not for everybody. It's really the most benefit we see is in patients that have a high body mass index or patients that have complex anatomy, and it's safe and feasible to perform the robotic transplant Because what the robot really helps us do is we minimize the morbidity on the patients. So basically, they bleed less during the surgery, they have less wound complications because the incisions are much smaller, and then they recover quicker and they get back to life quicker. So it's great if we could do it for everybody, but unfortunately, it's really mainly for patients that derive the most benefit. And those are the patients, like I said, the high BMI patients, the complex anatomy, and the patients that want to have it done as well, because like I said, it is not for everybody. The robot helps us the robot helps us perform these surgeries on both the donor and the recipient. So it helps us get the patients through in as least morbid as possible. The robot is controlled purely by us. It's not like you press a button and it goes. And it kind of helps us because it gives us better vision, a better precision during the surgery, and ultimately it puts the patients at the heart of this innovation. If we compare robotic transplantation to open transplantation, the major benefits are the patients have smaller incisions, so their wounds heal better with less risk of wound infections and hernias. The patients bleed less during the surgery because the dissection is much more refined. There's better vision with the robotic camera platform. And that helps us also do more refined, or let's say more precise movements. And ultimately, the patients will recover quicker with smaller incisions, and hence they will go back to life quicker. So that all puts the patients at the heart of like I said, the innovation. Also, congruently, it helps the hospital system because ultimately quicker recovery means these patients can stay less in the hospital. It minimizes the burden on the healthcare system in terms of complications related to transplant and length of stay requirements. So all in all, it's a win-win situation for everybody, the patient, the surgeon, and the hospital system. In most of the literature published reports on these cases of robotic transplantation, what we see frequently, or what I've seen in practice as well, is these patients require less or sometimes no narcotics after this surgery. So that helps them recover better and get back to their normal daily life in a faster fashion. I'm very grateful to have gone down this pathway where I trained as a urologist and then I trained as a multi-organ transplant surgeon specializing in kidney, liver, and pancreas transplantation. Because of the transplant techniques in liver transplant and in pancreas transplant, it has kind of helped me tackle the cases in urology that require not just urologic principles of surgery, vascular principles of surgery, and transplant specifically, the ability to handle diseases such as cancers involving the great vessels, or cancers that are large and involving multi-organ resection. That helps me provide a comprehensive care for the patients. It also helps me work with my colleagues in urology as well, which I enjoy doing here at MedStar Georgetown as well. And I would like to see more urologists down this pathway because I think it helps the urology patient community significantly. I think the future of transplant definitely involves the robot heavily. It also involves xenotransplantation, which is already under play right now currently. But I think the robot is here to stay, as they say, and I think more and more programs will adapt the robotic approach to transplantation. I think more and more patients will undergo robotic transplantation. Right now, I would say the balance is definitely tipped over to open or conventional transplant. However, I think in the next 10 years, the number of transplants performed robotically will definitely reach at least around 40-50%, if not more, in some programs, which I think is very exciting for us as surgeons and as well for the patients, because that ultimately translates into a better and a more satisfying outcome.